Hi, today we're going to discuss the North Carolina Handicaped Parking Privilege Certification. This is a policy analysis from a healthcare perspective by Beverly Mott. The North Carolina Handicaped Parking Privilege Certification provides governance for and issuance of handicap placards. This policy is divided into three sections: parking, handicapped car owners, and handicapped drivers and passengers. Section A describes where and when a person can park using a handicap placard. This section also points out that some areas are not applicable for handicap parking, so the driver should be aware of the proper use of the handicap placards. Section B gives the handicapped car owner the option of applying for handicap license plates. Section C discusses the issuance of handicap placards, the use and display of handicap placards, expiration, renewal, and the healthcare providers who are eligible to certify handicap placards. The designation of handicap parking places and enforcement of the statute are also discussed in Section C. In this situation, legislatures, healthcare providers, and the North Carolina Department of Motor Vehicles, or the DMV, all work together to influence the policy and how it affects handicapped persons. Issuance of the handicap placards requires support from the healthcare provider and the DMV. In the clinical setting, healthcare providers come into contact with those who may benefit from the handicap placards, but may not be familiar with the process or how to initiate the certification process. Healthcare providers have been influential in establishing this policy and initiating the changes and updates to the policy. This video can help increase awareness of the current policy and the changes that are needed. There have been several changes in the recent background of this policy. In 2015, the policy was changed so that permanently disabled handicapped persons could apply for a handicap license plate without so much paperwork. It would reduce their paperwork. Prior to 2017, the DMV interpreted the previous law not to include nurse practitioners and physician assistants as eligible to certify disability because they were not expressly listed in the statute. Many other states had already enacted this legislation to approve nurse practitioners to certify eligibility for healthcare handicap placards. Some of those states were Utah, Virginia, Alaska, California, and Michigan. This pressure from other states may have influenced the legislature's decisions to include nurse practitioners and physician assistants in the policy. House Bill 11 was filed in January of 2017 and with support of the North Carolina Nurses Association and the North Carolina Academy of Physician Assistants. This bill proposed that nurse practitioners and physician assistants are eligible to provide medical certification of disability, and that certified nurse midwives can provide certification for temporary handicap placards. Primary sponsors of this bill were Representatives Adcock, Dobson, Hardister, and Cunningham. With bipartisan support, the bill made it through the House Transportation Committee and after some modification passed the House and was sent to the Senate floor. The North Carolina Nurses Association News followed the story closely and reported on July 12, 2017 that Governor Roy Cooper signed into the law the bill allowing nurse practitioners, certified nurse midwives, and physician assistants to certify handicap placard applications for the DMV. The new law allows nurse practitioners, certified nurse midwives, and physician assistants to certify disability for the DMV placard applications. This state policy requires time from healthcare providers for certification of eligibility and may require multiple visits to the DMV by the patient. The strengths of this policy include clear description of the parking locations and times applicable for handicap placard use. The policy also specifies when the handicap placard does not apply, such as when parking spaces are designated for certain vehicles or when parking is prohibited. Another strength is that the policy allows for handicapped car owners to obtain handicap license plate and one removable windshield placard with no additional fee. Instructions for display of the handicap placard are clearly described in the policy, including options for motorized wheelchair use. Fees for the handicap placard are minimal, which are $5, or the cost to produce, whichever is greater. The primary care providers include licensed physicians, licensed ophthalmologists, licensed optometrists, a certified nurse midwife, a nurse practitioner, and a physician assistant. Also, the Division of Services for the Blind and the United States Department of Veterans Affairs can certify that the applicant is handicapped. No new equipment or computer software is required by the healthcare provider, which is another strength of this policy. Enforcement of the law was described, including fines and appropriate signage that are required. Healthcare providers have access to online resources for instructions about the process of handicap placards and the definitions of the terms used in the policy and the application through the DMV. Some weaknesses of this policy are obvious. First, the terms are not defined clearly. Handicapped, temporary removable windshield placard, or removable windshield placard. Their distinguishing terms are not described clearly in the policy. Healthcare providers must know which placard the person is applying for and should be able to easily distinguish applicable placard to request. This is not discernible from the policy. Secondly, the handicap parking spaces are not required to have a space for wheelchair access. We'll look at an example to show the need for this. You can see here the handicapped driver, the wheelchair trying to get into the car. If there's not enough space where they can pull the wheelchair up and open the door completely, then the handicap placard is not much use because they can't get to the car for entry and exit. This may discourage or limit the ability of the persons applying for the handicap placard, and it may limit their use of the designated parking areas. Another weakness is the lack of communication between the legislators and the healthcare providers. Currently, healthcare providers must rely on professional organizations or news media to stay informed of legislative changes in healthcare policy. So now we'll look at the opportunities this policy provides. The policy provides opportunities for education to healthcare providers about how the process for applying for a handicap placard works and the definitions and terms used in the policy. The policy also presents an opportunity for education resources for healthcare providers in the use of the handicap placard policy. Another opportunity is education for the legislators to know about the importance of defining terms and processes when initiating a new policy. There's also another educational opportunity about public awareness. The public should know when a handicap placard is appropriate and when it is not. Opportunities for legislators to define these terms is also evident in this policy. Defining these terms can assist healthcare providers in correct use of the policy. An additional opportunity would be for a communication forum directly between the legislatures and the healthcare providers. All right. Now we'll look at threats. Healthcare provider visits for issuance of handicap placards may not be covered by insurance, Medicare, or Medicaid, and the cost may be prohibitive for some patients who would apply. Usually, the issuance of handicap placards is included in another visit. This policy is subject to restraints and requirements of the Department of Motor Vehicles, and the DMV determines final approval of handicap placards. The policy is threatened by additional time requirements of the healthcare providers to complete the handicap placard certification form. Public perception of North Carolina citizens should not be underestimated when it comes to policy. Should the public perception toward handicap placards become hostile, the bill could be set in place in the House of Representatives and with public persuasion continue through the process until it's law. Public perception could change any part of the law. Ethical considerations. Many may consider the policy itself ethical because it eases a burden on handicapped persons. When considering what Butts and Rich said in 2013, there are 4 areas of ethics that we will look at: autonomy, beneficence, non-malfeasance, and veracity. By providing handicapped parking places, an individual's autonomy or right to decision making is supported. By enabling the handicapped person to do personal shopping and errands, the individual has a much greater capacity to make decisions for self. Beneficence means to do good to others. By observing the designated parking places for handicapped people, everyone can do good to others. Healthcare providers practice beneficence whenever they certify eligibility for truly handicapped persons. Non-malfeasance is exhibited as no harm is done to anyone while providing handicap placards. Healthcare providers may feel pressured by patients to certify eligibility for handicap placards when the person is not handicapped. The healthcare provider must exhibit veracity in telling the truth and not intentionally misleading the DMV into issuing a handicap placard. The healthcare provider must also educate the patient on the appropriate use of handicap placards. Proposed modification for this bill. The proposed modification would say that handicapped angled or straight parking spaces should have a 5 feet space for wheelchair access on both sides of the parking space. The rationale for this proposed modification is that handicapped drivers and or passengers may not have space to get in or out of a wheelchair if another vehicle is in adjacent parking spaces. Consider the space a wheelchair-bound person will need to enter the car without damaging a car beside of them. Handicapped persons with walkers also use additional space when entering a vehicle, and wheelchair ramps on the sides of vehicles require additional space. Potential obstacles to this modification could come from property owners who are concerned about the cost of repainting current handicapped parking places. One way to assist with this is to allow a 5-year implementation period for current spaces and immediate implementation for new construction. This would allow the additional space to be added when parking places were already scheduled for repainting. Sidewalk or foot traffic space may also be used toward the 5 feet wheelchair access space. To evaluate the effectiveness of this amendment, a survey could be completed on renewal of the handicap placards about the extended access space. Effectiveness of this amendment can be determined by asking the handicapped persons a question when they come in for renewal. A question like, does the additional space beside handicap parking areas make entering and exiting your vehicle easier? Answers could be always, sometimes, or never. The change would be considered effective if 50% or more of the answers were always or sometimes. The usefulness of handicap placards is limited by insufficient access space beside the handicap parking places. Although a healthcare provider may certify eligibility for the handicap placard, the patient may still be unable to park closer due to limited access space beside handicap parking places. Requiring additional access space would allow full use of the handicap parking privilege. So, I urge the North Carolina legislators to consider this amendment to the handicap parking privilege certification law and assist the handicapped person in wheelchairs with easier access to their cars. might be a keeper.